Welcome to the Legacy Holistic Health Coach Training Module 40. Now, in this module, we're going to be discussing what lung disease is, the types of respiratory diseases, some symptoms, risk factors, and treatments when it comes to different types of lung diseases and lung disorders. Now, the word for this particular module is breath. When we're talking about the lungs and the respiratory system, every breath we take counts, and every breath we take must have a high integrity and high ability to be able to oxygenate our blood cells so that oxygen can be carried throughout the body into all of our tissues. And so breath is literally the gateway to everything that gives our body life. It is the thing that distinguishes the living from the non-living, and it is the way that our body gives energy to our cells and to our blood cells especially, so that they are viable and they can carry the nutrients that are necessary to keep our body going. Now, respiratory diseases are a group of medical diseases, or it's a medical term that encompasses pathological conditions that affect the organs and tissues that make gas exchange possible in all higher organisms. That includes conditions of the upper respiratory tract, the trachea, the bronchi, the bronchioles, the alveoli, the pleura, and the pleural cavity, and the nerves and muscles of breathing. Now, the most common pulmonary diseases are the ones that are here on your screen. So there's different types of pulmonary diseases, and the different types are chronic respiratory diseases, and these are going to be your long-term chronic conditions that go on and create a variety of different symptoms. Lung diseases affecting just the air sacs, which are the alveoli. Lung diseases that affect the chest wall, meaning the muscles that we use to breathe, like the intercostal muscles that are attached to the ribs. When we take a breath, these muscles relax and contract to lift the chest, to lift the chest cave or the chest cavity and the rib cage up and away from the lungs, so that the lungs can actually expand and take air in. And then lung diseases affecting the blood vessels or the vasculature that goes to the actual lungs. Now, some different types of these diseases, before we get into each of those, some of the most common ones are called asthma, collapse of part of the lungs, which is called a pneumothorax or atelectasis, swelling or inflammation in the main passages, which are the bronchial tubes that carry air to the lungs, or bronchitis, COPD, or chronic obstructive pulmonary disease, as it's called, lung cancer, lung infections like pneumonia, abnormal buildup of fluid in the lungs, which is pulmonary edema, and blocked lung arteries, or pulmonary embolus. Now, the study of respiratory disease is known as pulmonology. And so a doctor who specializes in respiratory diseases or treating respiratory illnesses is known as a pulmonologist. So a chest medicine specialist, a respiratory medicine specialist, a respirologist, or thoracic medicine specialist. Now, respiratory therapists are allied health professionals who work alongside doctors to help patients become well. Since doctors don't have the time to be able to see all the patients all the time on a consistent basis, respiratory therapists see these patients consistently, giving them treatments in medical and emergency locations when the doctor may be busy or not around. So the doctor issues orders of frequencies of medications and treatment, and the respiratory therapist begins to see that patient consistently so that they can get the treatments they need to be able to get and stay well. Now, respiratory disease is common and significant cause of illness and death around the world. In the United States alone, approximately 1 billion common colds occur each year. These are considered respiratory illnesses. A study found that in 2010, there were approximately 6.8 million emergency department visits for respiratory disorders in the U.S. for patients under the age of 18 alone. So in 2012, respiratory conditions were the most frequent reason for hospital stays among children. Specifically in the UK, approximately 1 in 7 people are affected by some form of chronic lung disease, most commonly chronic obstructive pulmonary disease or COPD, which includes asthma, chronic bronchitis, and emphysema. Now, respiratory diseases, especially lung cancer, are responsible for over 10% of hospitalizations and over 16% of deaths in Canada. In 2011, diseases with respiratory or ventilatory support accounted for 93.3% of ICU utilization in the U.S. So respiratory diseases are very common worldwide, and it's one of those niches that would be very beneficial for a health coach to be able to specialize in or learn more information about. So it won't be uncommon if you see clients or have clients who have respiratory illnesses. Now, let's talk a little bit about, now that you understand a little bit about the prevalence and who's responsible for helping people get well, the respiratory therapist or the pulmonologist or chest medicine specialist and different people like that. Let's go ahead and let's take a look at the different types of respiratory diseases that we have presented here. Respiratory diseases can be classified in many different ways, including by the organ or tissue involved, by the type and pattern of associated signs and symptoms, or by the cause of the actual disease. Now, when it comes to chronic respiratory disease, CRDs, as these are called, are diseases of the airways and other structures of the lung. They are characterized by high inflammatory cell recruitment or neutrophils, and or the destructive cycle of infection, which is also called Pseudomonas or something like that. Some of the most common are asthma, chronic obstructive pulmonary disease, and acute respiratory distress syndrome, or ARDS, which is called, or ARDS. CRDs are not curable. However, various forms of treatments that help dilate major air passages and improve shortness of breath can help control the symptoms and increase the quality of life for people with the diseases. The trachea or windpipe, which are the branches into the tubes called the bronchi, which in turn branch to become progressively smaller airways throughout the lungs called alveoli eventually, which are the terminal air sacs of the lungs. Be sure to review the module on the respiratory system so that you're familiar with the different types of the different airway types within the lungs and how they sequence. Please view the following chart that is also in your notes that accompany this module so that you also have a reference to how the air sacs graduate from being the trachea to the right and left main bronchus, and then all the way down to the terminal bronchioles and the tiny air sacs. Now, pulmonary diseases can affect the system in many ways. They affect the air sacs. They affect the airways, the large airways like the main one, the trachea. They affect the chest wall. They affect blood vessels. They affect the interstitium, and they affect the pleural lining. So there's several different ways chronic lung disease can affect how a person actually does things and how a person actually breathes, and how, with the disease progression, many things can actually happen. Now, some diseases that affect the airways are things like asthma, which is the airways where the airways are persistently inflamed and may occasionally spasm, causing wheezing and shortness of breath. Allergies, infections, or pollution can trigger asthma symptoms. Chronic obstructive pulmonary disease, or COPD as it's called. Lung conditions defined by an inability to exhale normally, which causes difficulty breathing. In COPD, air gets trapped in the distal airways, and it causes the chest to look wide and round, because there's an obstruction to the outflow of the breath. So a person can breathe in, but when they try to blow all of the air out at once, the air actually can get trapped in the lungs because of the chronic obstructive process. And because of that, If a person with COPD breathes out too fast, it can potentially collapse their distal airways, making it difficult for air to get back into the lungs altogether. And so you will typically see a person with COPD sitting, if they're in distress, they'll be sitting upright in a chair, usually with their hands either clenching their lap or clenching the side of the chair to brace themselves so that their chest can lift and get air in. Additionally, one of the things that you'll see is that they have what is called clubbed fingers. And clubbed fingers is a chronic condition where the fingertips look large and rounder than the rest of the hand. The nails tend to fold over and curve all the way over the tips of the fingers as well. And so there's several signs of a chronic condition or something that's been going on for a very, very long time. Typically, the nails are also discolored. The nail beds may also be blue or palish in color instead of bright pink red. And there are several different things that you can assess or look at in terms of chronic lung disease, especially COPD. Now, people with COPD may also have a different pattern to the way that they breathe. And so it is something that is called pursed lip breathing. And in this pursed lip breathing, a person actually is slowly blowing their breath out so that their lungs don't collapse. Chronic bronchitis is a form of COPD and is characterized by chronic productive cough. And so these particular people typically are typically are people who have chronic inflammation, and they have chronic inflammation from long-standing inflammation, and as a result, it produces a chronic cough. Emphysema or lung damage allows air to be trapped in the lungs in the form of COPD, and it makes it difficult to blow air out, and that's its hallmark. Now, as a result of emphysema having an obstructive process as well, emphysema also creates the distal air sacs and traps air in, but it also allows the distal air sacs to be overfilled, and as a result, they get stretched out. So it's not uncommon on a CAT scan or a CT scan or an MRI scan to be able to see the lung sacs, the distal airways of the lung to be large and blown out like a stretched out balloon. And so this is literally the hallmark. And so of emphysema and even severe COPD. Because it's a chronic obstructive process and air is permanently trapped inside of the distal air sacs of the lungs, you will find that instead of a person having these beautiful clusters of sacs that look like small grapes, you'll find that all of the separations between the sacs have been blown out, and the distal airways, the distal alveoli no longer have the walls that separate them. Acute bronchitis or a sudden infection is the hallmark of acute bronchitis, and it usually comes as a virus. Cystic fibrosis is also a genetic disorder that causes poor clearance of mucus from the bronchi, and as a result, the accumulated mucus results in repeated lung infections, inflammation, trapped air, difficulty breathing, and things like that. Now let's take a look at lung diseases that affect the air sacs. Now, the airways eventually branch into these tiny tubes or bronchioles that dead end into these clusters of air sacs called alveoli that look like these grapes. And the air sacs make up most of the lung tissue. Lung disease affecting these air sacs include Lung diseases that affect the air sacs include things like pneumonia, which is an infection of the alveoli that's usually caused by some strain of bacteria. Year after year, when it comes to the pneumonia and flu, people try to get different kinds of vaccines and things like that. But in many cases, it is almost impossible to be able to know what strain of bacteria is going to be the most prevalent each year. So that's why every time the seasons change or the winter comes in, you will see that people still end up contracting the flu and severe pneumonia because the goal is to try to understand what strain is going to be prevalent and then how to treat that strain and vaccinate people against it. But in many cases, we have to remember that sometimes this is like a stab in the dark. And so it's not always simple, cut, and dry to be able to nail the strain, know the strain, and then have people treated or vaccinated against that strain. So you'll almost always see the outbreaks of pneumonia and the flu around that season. The goal, though, for people to prevent it is to make sure that they're doing several other things other than vaccinations to help them stay well. Tuberculosis is a slowly progressive pneumonia caused by the bacteria Mycobacterium tuberculosis. Tuberculosis can also be treated. It is treated as not a chronic lung disease, but an acute one. And it can successfully be treated and cured. Emphysema that results from damage to the fragile connections between alveoli, usually things like smoking and even secondhand smoke, is the usual cause. Now, emphysema also limits the airflow, affecting the airways as well. But its primary hallmark is that it breaks down the walls between the alveoli. Pulmonary edema is where fluid leaks out of small blood vessels and into the lungs and into the air sacs and the surrounding area. One form is caused by heart failure, where fluid backs up into the heart where the heart's not pumping as well as it should. And so any blood returning from the lungs to go out to the body, right? So blood comes into the heart from all of the extremities in the body. It goes to the lungs to get oxygen, and then it goes back to the heart to go out to the body. So if anything in this process is backed up, if the heart's not pumping as well as it should, if return from the extremities is not as great as it should be, you will eventually see an issue at the lungs. And so the goal, we have to understand that anytime the heart and lungs work together like this beautiful married couple, and anytime something is wrong at either one of those levels, the other person is affected, or the other system is also affected. So when it comes to pulmonary edema, that's an example of something being affected at the space of the lungs, but it can be caused from something happening with the heart, and it causes back pressure into the lung and blood vessels. In another form, though, it's direct injury to the lungs that causes some kind of fluid to actually leak. Now, lung cancer actually has many forms, and it can develop in any part of the lungs itself. Most often, this is the main part of the lung. In or near the air sacs is where lung cancer starts to develop. Now, the type, location, and spread of lung cancer determines the treatment options. Acute respiratory distress syndrome, or ARDS, is a severe sudden injury to the lungs caused by a serious illness. Life support with mechanical ventilation is usually needed to survive until the lungs recover. Pneumoconiosis is a category of conditions caused by the inhalation of substance that enters the lungs. Some examples include black lung disease from inhaled coal dust, or asbestosis from inhaled asbestos dust. Now that we understand some diseases affecting the alveoli, or the air sacs, let's take a look at some things that affect the actual chest wall, the structure of the chest cavity. Now, the chest wall plays a very important role in breathing. When we breathe, our intercostal muscles and our muscles work together to lift our chest cage up and forward to make sure that the lungs have room to expand. The more breath we take in, the more our intercostal muscles are actually contracted to pull our chest forward so that we can begin to get breath in. If anything happens to the chest wall or the rib cage, it begins to become an issue for the lungs because they may not be able to expand as well as they could. Muscles connected to the rib cage, to each other and to the ribs, help the chest expand, and the diaphragm then descends with each breath. And this causes the entire chest expansion process. So some things that can get in the way of this are obesity, hypoventilation syndrome. So when there's extra weight on the chest and the abdomen, it makes it difficult for the ribs to lift the chest forward and for the diaphragm to completely depress down, allowing the lungs to expand. Now, serious breathing problems can result from this because the lower air sacs in the lungs, those beautiful clusters of grapes, start to get stuck together, and they actually start to not be as good or be able to inflate as best as they normally can. Remember, blood coming into the lungs from the heart is there to pick up oxygen. The degree of the amount of oxygen it picks up is based on the ability for the air sacs to expand and for gas exchange to occur. When these air sacs are collapsed and when they are compromised, the vasculature around them are compromised and the ability to carry oxygen to the tissues is compromised. That's why it's not uncommon to see people with any types of chest wall deformities or any types of chronic lung diseases to have blue fingertips or pale extremities and things like that. Other disorders are called neuromuscular disorders. Poor function in the nerves controlling the respiratory muscles causes difficulty breathing. Things like amyotrophic lateral sclerosis or myasthenia gravis and Guillain-Barré are examples of neuromuscular lung diseases that cause issues. Now let's look at some diseases affecting the actual blood vessels. Now, the right side of the heart receives low oxygen blood from the veins. Let's take a quick review here. Then it pumps that blood back into the lungs through the pulmonary arteries. Now, these blood vessels can suffer from some kind of disease as well. And some of these diseases that these vessels can actually suffer from are things like what we call PE or pulmonary embolism. And this is where a blood clot, usually in a deep leg vein or deep vein thrombosis, breaks off, travels to the heart, and is pumped into the lungs. The clot lodges in a pulmonary artery, often causing a shortness of breath and low blood oxygen levels. There's also pulmonary hypertension. And this consists of various conditions that can lead to high blood pressure in the pulmonary arteries. Now, this can cause shortness of breath and chest pain with no cause. When no cause is identified, the condition is called idiopathic pulmonary arterial hypertension. Now that we understand some different ways chronic lung diseases can affect the vessels, the alveoli or the air sacs, the chest wall, and the lungs themselves and the large airways themselves, so let's look at some symptoms that typically happen when people have some form of chronic lung disease or chronic breathing issues. Pulmonary disease symptoms depend on what type of disease process may be present. However, the majority of lung issues share some similarities, and these are warning signs of the symptoms that could be happening. Chronic cough is a cough that a person has and they have for a month or longer, and it's considered chronic after 30 days. This is an important early symptom that tells that something is wrong with the respiratory system. We cough in order to clear out our airways. So it's not uncommon to cough just to clear out things. When we're around dust or smoke and things that the body doesn't normally process well, We tend to cough to get these things out of our system since our body wants to keep anything foreign to the system outside. And so it's not uncommon to have a cough, but a chronic cough that persists in the absence of smoke, in the absence of anything that would cause the body to have to cough on a consistent basis is an early sign. Shortness of breath, or SOB, as you may see it written, it's not normal to experience shortness of breath that doesn't go away after exercising, or that the person has had after little or no exertion. Labored or difficulty breathing, the feeling that it is hard to breathe in and out, is also a warning sign. A person may also say that they feel like an elephant is sitting on their chest and they can't get any air in. That's also a warning sign. Chronic mucus production. Mucus is also called sputum or phlegm, and it's produced by the airways as a defense against any type of infection. Or irritants. So if we breathe in irritants and different things, mucus forms from the cells in the as an immune reaction, and mucus forms to be able to trap the dust. So it's like a glue that traps dirt and dust. And then as a result, when something is trapped, we cough it up to expel it all out in one fell swoop. So if a person has consistent mucus, especially if they're not around irritants, then it's a warning sign as well. If the mucus production has lasted a month or longer, it could indicate chronic lung disease. Wheezing, which is noisy breathing or wheezing, is a sign that something unusual is blocking the airways or making them too narrow. When you think in terms of wheezing, I want you to think about trees in a forest and the wind blowing through. When there are no trees or there's an open space in the forest and wind blows, it simply blows and there's very little sound. That is how the lungs typically should sound. You should be able to hear the breath going in and out without any kind of abnormal sounds or noises. When there are a lot of trees in the forest and a wind blows through, the wind has to navigate all the leaves and the branches of all the trees, and so you hear a lot of noise, the whistling of the wind. This is the same thing that happens when there is something stuck or trapped in the airways. The air that you breathe in has to navigate the object or something that is trapped, whether it's mucus or whether it's a tumor or no matter what it is. The air that you breathe in has to navigate around the edges of that particular blockage, and so wheezing may be heard. Also, if the airways begin to narrow, like in an asthma attack or inflammation takes over, once again, the air that you breathe in has to navigate the blockage or the smaller tube. And so you may hear wheezing in people with obstructive breathing processes. Coughing up blood may be coming from the lungs or upper respiratory tract. Wherever it's coming from, it's definitely a signal of a health problem. Although blood goes around the air sacs of the lungs to pick up oxygen, it's never actually inside of the lungs, right? And so anytime a person is coughing up blood, it's definitely a sign that something has been compromised. Chronic chest pain is known as unexplained chest pain that lasts for a month or more, especially if it gets worse when a person breathes in or they cough. It's also a warning sign that something may be going on. So before we talk about risk factors, let's talk really quickly about when it might be beneficial to actually see a doctor. So I want you to encourage a client to see a healthcare provider if the following thing, and to take the following steps. Take a copy of whatever medical records they have when they go see their doctor or when they go see a healthcare provider, or get a copy sent. If they're unable to obtain their medical records, they can also write a short note about their health problems and when they occurred so that the healthcare providers can take care of them properly. The second thing they want to do is make a list of all the medicines that they're using right now. This means prescribed medicines, over-the-counter medicines, herbs, supplements, and any non-traditional methods that they're using to try to treat their cough or anything that they've got going on. The next thing they want to do is make a list of all the healthcare providers that they see and why they see them. And then they want to make a list of the symptoms they're having and note which ones bother them the most. So writing these things down make the person a great historian and the ability to be able to follow everything that they've got going on and to be able to understand whether chronic process is there and how they can be treated properly. Now let's talk a little bit about some risk factors that people may be faced with when it comes to chronic lung diseases. There are a number of risk factors similar to many of the causes, that are associated with developing COPD, some of which may be in the person's control. So tobacco smoke, while the risk factor varies for different people, the more packs and times a person smokes, the higher their risk of developing some form of chronic lung disease will be. Smoking cigars, pipes, marijuana, and also all these things increase, and the exposure in secondhand smoke also is equally, if not more dangerous than actually smoking. The point is that the person smoking the pipe or the cigarette has a filter versus this person receiving the secondhand smoke has no filter. If they smoke and have a family history of COPD, their risk further increases because of this particular habit. Asthma or some form of existing lung disease. So if a person has asthma and also smokes, research shows that their risk of developing COPD is 12 times higher than those who don't smoke and have asthma. Long-term exposure to irritants such as chemicals, dust, fumes, and other workplace, secondhand smoke, or air pollution, it increases the risk of developing COPD. If a person works with irritants, and they have them talk to their employer about protection. Now the age. So since COPD develops over the course of years, most people are at least 40 when they are diagnosed. Additionally, as we age, our airways appears to go through some of the same structural changes that are found in COPD. When it comes to chronic bronchitis, if a person is a younger adult and has chronic bronchitis or smokes, their chances of developing COPD is definitely much higher. Now, the socioeconomic status also plays a role in this. So having a lower socioeconomic status poses an increased risk of developing COPD, but some research isn't exactly sure why. Now, this could be related to poor nutrition, infections, exposure to irritants, or the effects of smoking, which is most common in lower socioeconomic status people. Infections also play a role in this, especially if a person has a history of severe childhood respiratory infections. And this puts them at very high risk of developing COPD. Having tuberculosis is also a risk factor that sometimes occurs in addition to COPD. If they have human immunodeficiency virus or HIV, they can also speed up the development of COPD that's caused by smoking. Now let's take a look and try to understand how these things are actually diagnosed. Now, respiratory diseases may be investigated by performing one or more of the following tests you see here on the screen. A biopsy is a medical test that's commonly performed usually by a surgeon or interventional radiologist or an interventional cardiologist involving extraction of sample cell tissue for examination to determine the presence and extent of any disease process that's happening. Now, the tissue is generally examined under a microscope by a pathologist and can be analyzed chemically as well. When the entire lump is suspicious, it's removed, and the procedure is called an excisional biopsy. Blood tests are also a great way to test for these types of diseases or diagnose them. A blood test is a laboratory analysis performed on a blood sample that is usually extracted from a vein in the arm using a hypodermic needle or via finger prick. Multiple tests for specific blood components, such as glucose tests or cholesterol tests, are often grouped together into one test panel called a blood panel or blood work. You also find that a CBC, like we covered in diagnostics or in the diagnostics module, is also a way to get information about this particular type of disease process. Bronchoscopy is an endoscopic technique of visualizing the inside of the airways for diagnostic and therapeutic purposes. Now, an instrument is called a bronchoscope. It's inserted into the airways and usually through the nose or mouth, or occasionally through a tracheostomy. This allows the practitioner or the doctor to examine the patient's airways for abnormalities like foreign bodies, bleeding, tumors, or inflammation. Specimens may be taken from inside the lungs as well. Now, a CT scan or computed tomography scan, it's also called a CAT scan. It is or formerly called the CAT scan. It makes use of computer process combinations of many X-ray measurements taken from different angles to produce some cross-section images of the inside of a specific area. And so getting cross-section angles of the lungs is a great way to begin to get information to diagnose chronic lung diseases. Microbiology cultures or microbial culture is a method of multiplying microbial organisms by letting them just reproduce in a predetermined type of culture or medium under a controlled laboratory condition. So these cultures are the foundation of basic diagnostic methods. They are used extensively as research tools in molecular biology, and they're used to begin to diagnose what a person may have with chronic lung disease. Medical ultrasound, and this is also known as ultrasonography or basic sonography, is also a diagnostic imaging technique that's used based on applications of ultrasound. Now, it's used to create an image of the internal body structure, such as tendons, muscles, joints, bones, and vessels, and it allows the doctor to see the internal organs. So it's a great way to begin to see the different lungs and what's going on. PFTs are the cornerstone for diagnosing any chronic lung issues, and they create a complete evaluation specifically of the respiratory system, and it includes the person's history, their physical exam, tests, and even the function of their actual lungs and what percentage their lungs are functioning at. Now, the primary purpose of a PFT is to identify the severity of any type of pulmonary or lung issue or impairment. Ventilation perfusion scan, or a VQ lung scan as it's also called, is a type of medical imaging that uses scintigraphy and medical isotopes to evaluate the circulation of air and blood within a patient's lungs in order to determine the ventilation perfusion ratio. Now, these are the different diagnostics tests that are used to diagnose chronic lung disease and the extent of a lung disease issue. They may be used singularly or in combination to get a very good picture of a person's disease state. Now let's take a look at some different ways that we can actually prevent lung disease. Don't smoke or quit smoking, and always avoid secondhand smoking. Try to reduce your exposure to pollutants in the environment at work and at home. Go to exercise regularly so that your lungs are opening and closing and becoming strong and healthy. Aerobic exercises that increase your heart rate is the best kind to use. Eat a nutritious diet. Get regular checkups with your doctor. And be sure to get a flu shot if you feel like it's necessary. And after you turn 65, look for a pneumonia shot as well. The goal, though, to avoid getting flu or pneumonia during the flu and pneumonia season is to make sure you take care of yourselves properly outside of those seasons. If you're at risk for any type of lung cancer, ask the doctor about screening options. Test your home for radon gas. Begin to wash your hands regularly and avoid touching your face, and stay away from people who are always sick. Now that we know some great ways to be able to prevent getting lung disease, let's talk about treatments and maybe some of the medications involved. So lung scarring that occurs in the interstitial lung disease can be reversed. And treatment will not always, it cannot always, it can't be reversed. Always. Sometimes it can. And then treatment will not always be effective in stopping the ultimate regression of the disease. But some treatments may improve the symptoms temporarily or even slow the disease's process down altogether. Others can help improve the quality of life. And because many of the different types of scarring disorders have no approved or proven therapies, clinical studies may be an option to receive an experimental treatment. Now, some medications that are used in the treatment of chronic lung diseases are things like corticosteroid medications. So many people who are diagnosed with interstitial lung disease are initially treated with corticosteroids like prednisone. And sometimes these are in combination with other drugs that suppress the immune system. Now, depending on the cause of the interstitial lung disease, this combination may slow or even stabilize disease progression. Medications that slow the progression or idiopathic pulmonary fibrosis, the medications called Esbriet, which is pirfenidone, and Obveb may slow the rate of disease progress down. Treatment-related side effects may be significant. Talk through the pros and cons of these medications with the doctor if a client needs these or if you need these. So medications that reduce stomach acid, called gastroesophageal reflux disease or GERD, affects a majority of people with lung fibrosis issues as well. So it's not uncommon to see people with lung issues on GI medications. If they have symptoms of acid reflux, the doctor may prescribe GERD therapy and reduce the stomach acid as well. Now, oxygen therapy is also used when the lungs are severely damaged, and it makes breathing and exercising easier. It prevents or lessens the complications of low blood oxygen levels. It reduces blood pressure on the right side of the heart, and it improves a person's sleep and well-being overall. If the person is most likely to receive oxygen when they sleep or exercise, although some people may have to use oxygen round the clock. This is indicative of severe chronic lung disease. Now, pulmonary rehab is also a treatment next to surgery as well. And the aim of rehab is not only to improve daily function, but also to help people with interstitial lung disease live full, satisfying lives. To that end, pulmonary rehabilitation programs focus on physical exercise to improve the endurance, breathing techniques that improve lung efficiency, emotional support, and nutritional counseling. Now, surgery is also a last-ditch effort, and that's when lung transplantation is an option as a last resort for people with severe interstitial lung disease who have not benefited from other treatment options.